As the sun rises in Orange Farm, south of Johannesburg, Portia Njangwini gets ready to see a doctor at Charlotte Maxeke Academic Hospital, 45 kilometers away. She was diagnosed with cancer in 2020 after discovering a lump.
The night before, so when I touched the breast, I felt that I have a big lump on my left side.
The gravity of the situation hit Portia when she saw a nurse for a checkup on her pregnancy.
So she felt the lump and said, no, this might be serious. I need to go to hospital.
The results weren't good.
I went back after 2 weeks to get the results. Then that's when I was told that I've got breast cancer stage 3. The doctors told me that I need to terminate the pregnancy because me being pregnant at that time, it meant I was feeding the cancer every day. That's why it was so aggressive.
She decided to go through with the chemo and keep the baby.
And then they took the tumor out and they had to cut the right breast just to resize it to this one. So after all that, I finished my chemotherapy. Then I was sent to Charlotte Maxeke for irradiation. I've been waiting for 10 months for irradiation, which I might go maybe soon. That's why they said I would wait for a year or more.
All patients, or 90% of patients.
The head of radiation oncology at Charlotte Maxeke, Dr. Devern Ramia, says it's not just breast cancer patients who have to wait.
So sometimes the breast cancer waiting list can go up to, 12 months to 18 months. And the prostate cancer waiting list is sitting somewhere around about 5 years at the moment.
The wait is because of staff shortages.
And that process involves a radiation oncologist, a radiotherapist, and a medical physicist. Now, the issue is in Charlotte is that we don't have enough of any of those three professionals to treat the number of patients that come in. And if you don't have an adequate amount of staff doing it, then you don't have enough radiotherapy plans being churned out of your department, and you can't actually fill all the slots in your machine. And that's where the issue actually lies now.
The problem with waiting too long for radiation is that it increases the chance of your cancer returning.
It's a very, very tough conversation to have with patients. And it's probably one of the reasons why a lot of radiation oncologists, for example, don't like working at a place like Charlotte, because you get involved in conversations that are difficult for you to have with patients. As a radiation oncologist, if you see a patient and decide that they need radiotherapy, you obviously want to get them treated, right? That's what you've done, that's what you've been trained to do. And obviously, if there's an issue in terms of the resources available to you, you've then got to explain to your patient that we know you need treatment, but we can't actually do it for you now because of various issues.
Over at Netcare's Mill Park Hospital, just 3 kilometers away, we find Dr. Carol Ben, who works at the Breast Care Center. She used to work part-time in the breast cancer department of a public hospital.
Copies of their reports and everything.
But I want to put on the table that private is not better than government. Each group has its own set of problems. The sadness is it's the people who are suffering for something that can be so well managed. So I do think that having some form of sensible national health, but it has to be managed properly. Every person has to be performance managed.
Louise Turner works with Dr. Ben. She's a breast cancer survivor, and even though she was on medical aid when she was diagnosed, it wasn't smooth sailing.
When I started, they were aware I'd been diagnosed and needed treatment, but the medical aid excluded me for a pre-existing condition for a year.
So she had to use public health care. In her experience, the difference in care often comes down to attitudes and access.
Unless there is a change in the attitude of our government, our clinicians, the hospitals, people cannot access services. Where you stay, what you earn, what your demographic is, what your bank balance is, etc., should not make a difference to accessing care.
Portia remembers feeling nauseous traveling back home to Orange Farm on public transport after treatment.
The sad part is going back after taking chemotherapy. It's not easy because you are not okay. You need someone.
She's anxious to be declared cancer-free, along with thousands of other people on waiting lists across the country.